I'm Dr. Sophia Ramírez, urologa, and today I would like to discuss a topic that many men call, but that makes them feel anxious and afraid. What happens if you have an orgasm without spitting semen? Sometimes it's something that upsets you, sometimes it's something that worries you, and sometimes it might make you feel like something is wrong with your body or your health. Let me say this. From the beginning, you are not alone, and it does not necessarily mean that your health has been lost. He saw many of patients in for consultation with this feeling of uncertainty. Some mention it in a low voice as though it were a secret, while others tell me straight out that they have stopped being afraid to tell their sister about it. This emotional load is as real as physical changes. Thus, the first step is to talk about it without taboos. Sexuality is a component of health, and what today appears to be a serious issue may often be understood and resolved. First, let's review what a typical eyaculación is in order to understand what it means to not have semen. The semen, composed of spermatozoides and fluids produced by the prostate and seminal vesicles, is expelled through the urethra during a male orgasm. This process is made possible by a coordinated movement of the reproducing device's muscles. It is the ideal mechanism that combines placer, descarga, and relationship. For most males, this fluid is visible, has a recognizable volume, and is in harmony with the ogonistic sense. Even though the climax sensation is present, we speak of a different phenomenon when that descent does not occur. And so begins our journey today to understand what might be happening and why your body is sending that signal. A condition known as secret eyaculación occurs when a man experiences an orgasm but does not expel semen. On the surface, it appears that the body has completed the process because there is a feeling of placement, but the visible, crucial liquid component is absent. This distinction is essential because, although they frequently occur together, eyaculasyon and orgasm are not exactly the same thing. Whereas eyaculasyon is the physical act of releasing semen toward the outside, orgasmo is the neurological response of placing and descarga. This confusion arises when the first occurs without the second, which is concerning to those who experience it. The causes can vary greatly and do not always point to a serious issue. One of the most common is retrógrada eyaculación. In this instance, instead of going outside, the semen would go toward the vejiga because the músculo, which functions as a valve in the vesical cuello, would not be able to properly close. As a result, the path toward the outside becomes blocked, and the semen takes the other route. This phenomenon alters the fluid's destiny, but does not prevent orgasm. Cirugías previas in the urethra, vejiga, or prostata are other common causes. In many cases, these necessary procedures to treat health issues may change the anatomy or nerves that control ejaculation. Something similar happens with some medications, including those used to treat hypertension, some antidepressants, and medications intended to treat prostate diseases. These may interfere with the mechanisms that regulate semen shedding. Neurological injuries also hold a significant position in the list of causes. Individuals with long-term diabetes, medullary lesions, or multiple sclerosis may experience changes in the nerve signal that controls the ejaculatory process. The body has an orgasm without this connection intact, but the semen's exit is blocked. Last but not least is hypoandrogenism, or the decline in testosterone levels. This hormone is essential to the formation and function of semen. When its level drops, the seminal fluid's quantity and quality also decrease and occasionally disappear. Regarding the frequency in young men, eyaculación seca is usually not common and is reversible when it occurs frequently. The story is different for people over 50 since they have chronic illnesses, changes related to aging, and sexually transmitted diseases. Consider the case of Jorge, a 58-year-old patient who was quite concerned since, after 2 months, His orgasms were vacíos, had undergone a laser treatment for prostate cancer, and no one warned him it would result in Retrógrada eyaculation. We had to explain that, despite being irreversible in their case, it had no effect on their potency or virility. This conversation was a lifesaver for him because he realized that his masculinity remained intact and that his life was not a punishment, but rather an expected secondary effect. Nowadays, yes, although while in many cases eyaculación seca does not represent an immediate danger, there are some individuals who must be valued by a neurologo without hesitation. The first is when a repentant lack of semen occurs without a clear explanation or history of medication or cirugías. A sudden change in the body is always a warning sign. The second situation is when there is pain, redness in the semen or orina, a loss of genital sensitivity, or a noticeable decline in sexual desire. These symptoms may indicate a more complex issue, ranging from infections to neurological or even tumoral diseases. Ignoring them would be an unnecessary risk. The third reason for an urgent consultation is when a man reaches a mature age and wants children. In these situations, sexual ejaculation becomes a direct barrier to natural conception. Even though there are medical solutions and assisted reproduction techniques, it is crucial to get a diagnosis as soon as possible to avoid losing valuable time. In conclusion, if you find yourself in any of these circumstances, don't be silent. Speaking with a doctor or other medical professional to help you recover can make the difference between a minor medical adjustment and a more serious issue. Eyaculación retrógrada is one of the most common causes of eyaculación seca among all the other causes. We must first picture how a healthy body should function in order to understand it. The vejiga's cuello closes with force during a typical orgasm, much like if it were a supplement. At the same moment, the seminal vesiculas and the prostata's muscles contract, pushing the semen outward and toward the urethra. When this mechanism is coordinated, the outcome is what we all know, a noticeable drop in semen accompanied by the placer characteristic. This component does not close during retrograda eyaculación. The vesicle cavity remains open and the semen finds a more convenient path inside the vehicle rather than going outside. I like to use the figure of a manguera with a bifurcation to illustrate this. The water will take the open path if one of these slides is closed and the other is open. La salida natural queda bloqueada y el semen se desvía hacia donde no debe ir el cuerpo. The most common causes of this phenomenon are well documented. Prostate surgeries like transurethral resection, vejiga, or urethra interventions might weaken or harm the nerves that cause the vesical cuello to stop. Additionally, some medications are used to treat hypertension, some tritially-based antidepressants, and medications to treat benign hyperplasia of the prostatitis. In some cases, the cause is neurological damage linked to long-term diabetes, multiple sclerosis, or medullary lesions. Additionally, pelvic radiotherapy used to treat prostate or vejiga cancer may cause scarring that changes function. Even though they are less common, congenital malformations do happen that make this mechanism more likely to fail. For whoever is experiencing them, the symptoms are usually clear. The man experiences orgasm but does not see semen or notices it in a very little amount. Some people describe the feeling as though they are looking inside. Because the orina contains spermatozoides that have drifted toward the vejiga, it may appear turbia after the relationship. The diagnosis is rather simple to confirm. The analysis of orina shortly after the orgasm is one of the most commonly used tests. The presence of spermatozoides in the specimen confirms retrophic ejaculation. Prosthetic echographia and a review of the clinical history can identify the precise cause and determine whether there are any additional factors, such as medications or underlying illnesses. Regarding fertility, This condition prevents semen from reaching the outside, which has compromised natural conception. However, this does not mean the end of reproductive life. It is possible to recover spermatozoids from the urina or directly from the testicles and use them in a fertilization treatment with assisted reproduction techniques. The cause determines the treatment. Sometimes it's best to suspend or substitute it under medical supervision if the origin is in a medication. Although the results vary, in some cases medications that increase the vesical cuello stone are used to encourage the normal salida of semen. Additionally, retrograda may be permanent if it results from a cirugía. However, that doesn't mean that sexual life and pleasure remain intact. My practical advice for anyone living with this condition is very clear. Do not be alarmed. It does not indicate a loss of masculinity or virility. Always consult your urologist because each case is unique and deserves a customized valuation. Remember that reproductive medicine offers effective solutions if you want children. Additionally, if you have chronic illnesses like diabetes, treat them well because they are one of the most silent causes of this issue. The obstruction of seminal vesiculas is another significant cause of eyaculation that is less well known than retrograda, but as important. It is convenient to note what role these structures play in order to understand it. The seminal vesiculas are two small glands located behind the vejiga, whose purpose is to produce between 60 and 70% of the entire volume of semen. Fructosa and other substances found in its secretion neutron and promote the spermatozoid's mobility. When functioning properly, they contribute the majority of the seminal fluid. However, if they block or inflame, the semen drastically decreases or even disappears, even as the orgasm persists. The obstruction may arise for a variety of reasons. Among the most prevalent are pre-existing infections such as prostatitis or maltrated urinary tract infections that cause cicatrices in ejaculators. Another common cause is seminal calculi, which resemble small renal calculi and partially or completely obstruct the flow of semen. There are also quistes congenitos in the area of the vesiculas or in the different conductos that are present from birth that might block the flow without causing symptoms until adulthood. Additionally, the local cirugías or pelvic traumas may cause temporary or permanent behavior changes. The symptoms directed towards this kind of obstruction are different from those of the retrograda. Many patients describe experiencing an incomplete orgasm or severe pelvic pain. When it appears, the semen is usually quite thick, reduced in volume, or contains grumos. Sometimes there is pain while evacuating or persistent pelvic molestias, and an important indicator is infertility without apparent cause in men who maintain a sexually active life with normal erections but are unable to conceive. There are risk factors that raise the likelihood of this issue. Men who have a history of recurrent prostatitis, have experienced pelvic trauma, or have frequent urogenital infections make up the groups with the highest predisposition. Additionally, older women with prostatitis and related inflammations should be aware of these symptoms. Specific tools are needed for diagnosis. The ability to observe the size, shape, and potential presence of quistes or inflammation in the seminal vesicles makes transrectal echographia an essential test. Semen analysis reveals indications of obstruction when low volume, fructosa absence, or pH changes are observed. In complex cases, pelvic magnetic resonance provides a more detailed image to identify deep lesions or congenital malformations. Additionally, an espermocultivo aids in the removal of persistent bacteria that may have caused fibrosis in the conductos when a chronic infection is suspected. Remember in particular the case of Fernando, a 34-year-old patient who sought advice from his spouse after 3 unsuccessful years of trying to conceive. I decided in frustration that although she had good sexual desire and normal erections, her semen was getting progressively less. After doing a transrectal ecografía, we found an obstruction in one of their seminal films. Logramos remove the quist using a minimally invasive endoscopic procedure. 3 months later, they received word that their wife was pregnant. These kinds of connections show how crucial it is to stay put and look for the true cause. The available treatments vary depending on the specific cause. When chronic infections are the cause of the obstruction, long-term antibiotics and anti-inflammatory drugs may be adequate. In cases involving calculations or quistes, endoscopic surgery through the urethra allows for the opening of the conductors and the restoration of the flow. Large quistes can be treated with ecografía-guided aspiration, an ambulatory procedure that doesn't require incisions. Recovery is usually quick and produces excellent results. We also need to mention other less common causes that can result in semen absence. One of these is ejaculatory anorgasmia, a disorder in which a man experiences stimulation but is unable to reach the climax or expel semen. Another is severe hypogonadism, which occurs when testosterone levels are so low that semen production virtually stops. There are cases of aplasia caused by seminal vesicles, and although they are extremely rare, men can be born without these glandulas. Lastly, oncological treatments like radiation or chemotherapy can also significantly suppress the production of seminal works. In conclusion, blockage of the seminal vesicles is a silent but treatable cause of secretion. Although their diagnosis requires specialized care, modern treatments offer effective solutions that give people hope and a higher quality of life when they thought their problem had no solution. The third major cause of secret ejaculation is related to hormones, specifically testosterone. This hormone, which is mostly produced in the testes, is the main regulator of spermatozoid production and the function of sexual accessory glands like the prostate and seminal vesicles. Additionally, it stimulates sexual desire, strengthens sensitivity during intimate acts, and encourages the contraction of the muscles involved in ejaculation. When levels are appropriate, the body reacts with desire energy and sufficient seminal production, but when testosterone levels start to decline significantly, the entire system starts to weaken. The lack of testosterone does not appear suddenly, rather, it usually shows up gradually. The man initially notices that the semen is smaller or more clear and aquoso. Shortly after, there is a decrease in sexual desire, a loss of rigidity in erections, and less intense or even brief orgasms. On a broader level, chronic fatigue, a decrease in daily energy, and difficulty maintaining muscle mass are also observed. A lot of men over 45 see these changes as a normal aspect of growing older, but they don't. Aging shouldn't be interpreted as a loss of vitality or a fulfilling sexual life. No actúa sola, despite testosterone being the main protagonist. The luteinizing hormone LH is responsible for stimulating the Leydig cells in the testes to produce testosterone. The follicle-stimulating hormone FSH plays a role in spermatozoid formation. Overproduction of prolactin can suppress testosterone production and significantly reduce libido. The quality of erections and ejaculatory capacity are affected by all hormones, including the thyroid hormones, when they are altered. Because of this, when cases of eyaculasyon are studied with hormonal suspicion, it is not enough to measure a single value. Hormonal deficiencies manifest as mild symptoms such as short or weak orgasms, low libido, difficulty maintaining erections, changes in humor accompanied by sadness or irritability, accumulation of abdominal fat, loss of muscle mass, and weakening of the body. It's also common to have an inadequate or rumpid sueño that makes things worse. These signs should be seen as a warning that something is out of internal equilibrium. For an accurate diagnosis, a complete hormone panel is necessary. LH, FSH, prolactin, and thyroid-stimulating hormones like TSH3 and T4 are typically requested along with total and free testosterone. When the levels of testosterone are at their highest, the woman should measure it. A total testosterone level below 300 is typically seen as an indicator of hypogonadism, while each case is evaluated based on age, symptoms, and antecedents. There are two main types of hypogonadism. The first occurs when the testicles do not react appropriately to hormonal stimulation and is often associated with testicular damage, antibiotic infections, chemotherapy, radiotherapy, or chemotherapy. The secondary occurs when the brain's hypophysis or hypothalamus malfunctions, preventing the serine necessary for testosterone production from being sent. This latter may be brought on by hypophysereous tumors, severe obesity during sleep, or long-term use of anabolic steroids. The cause determines the course of treatment. Testosterone replacement therapy can be administered through subcutaneous implants, gel transdermal patches, or intramuscular injections. This therapy improves overall life quality, energy levels, and semen volume. However, it is not advised for males who wish to have children because it may inhibit spermatozoid production. In these situations, alternatives like as gonadotropins, clomipheno, or anastrozole are used, which stimulate the body to produce its own testosterone and sperm. It's normal for testosterone levels to gradually decline in men over 50, but when this decline results in dysfunctional symptoms, we're talking about a disorder that requires attention rather than just aging. Assessing oneself throughout time enables one to regain energy, sexual desire, and life quality. It's crucial to avoid normalizing it, since the body speaks and always finds a way to hear it. As of right now, we have seen causes that, while they usually have a solution or do not pose a serious risk, secret ejaculation can also serve as a warning sign against serious illnesses that threaten not only sexual health but also life in general. Because of this, it's crucial to avoid normalizing it, especially when it occurs alongside other symptoms. First and foremost, there are urological cancers. Growing prostate cancer may inhibit ejaculatory behavior and prevent semen from shedding. In more advanced stages, it also causes painful or bloody eyaculaciones. Vejiga cancer can occur when it invades the vesical or urethral cavity, changing the normal semen flow and perhaps causing hematuria. Testicular tumors cause infertility and changes in the seminal volume when they impair sperm production or different behaviors. Before exhibiting other more obvious symptoms, these processes, however silent at first, manifest as changes in ejaculation. Another category is represented by neuropathias, one of the most common causes of nerve damage that affects the peen, the vejiga, the testicles, and the ejaculatory muscles is poorly controlled diabetes. The loss of ejaculatory semen is the first symptom of this condition, which is known as neuropathia autonomica diabetica. Additionally, conditions like multiple sclerosis, Parkinson's disease, spinal cord injuries, or cerebrovascular accidents interfere with brain reproductive communication, resulting in incomplete or partial orgasms. There are also autoimmune diseases and syndromes that, despite being less common, should not be disregarded. The systemic lupus erythematosus may cause inflammation in the blood vessels that supply the seminal vessels. Sarcoidosis can produce granulomas that prevent the semen from escaping, and sclerodermia persists in internal tejidos, causing fibrosis in the ejaculadors. These diseases have a worldwide impact on the body, and their first symptoms may appear in the sexual realm. There is also a role for severe postquirúrgic injuries. Cirugías de próstata, de colon de vejiga, or abdominal interventions may also change internal anatomy or shorten ejaculatory nerves. Following such an operation, the appearance of secret ejaculation should be reported right away to the doctor because it may be a direct result of the surgery. There are warning signs that should never be disregarded: sangre in the orina or semen, persistent pelvic pain, lumbar pain without a clear cause, piercing weakness, genital loss of sensitivity, urinary or fecal incontinence, and prolonged fever. These symptoms, when combined with eyaculación seca, are signs that something serious is happening and should be consulted right once. In some cases, the diagnostic study is more extensive. These tests include PSA to detect prostate cancer, uroflugiometry to assess the strength of the urinary tract, pelvic magnetic resonance imaging to identify tumors or fibrosis, neurological conductivity studies if neuropathologies are suspected, and autoimmune panels in patients with systemic symptoms. Si aparecen varios síntomas a la vez, la recomendación es clara: no esperar ni restar importancia. La eyaculación seca nunca debe verse de forma aislada. El cuerpo habla en conjunto, and when manda más de una señal es because necesita atención urgente. Detectar a tiempo una enfermedad severa puede significar salvar no solo la función sexual, sino la vida misma. A lo largo de este recorrido, hemos visto que la eyaculación seca no es una casualidad ni un simple detalle sans importancia. Puede haber consecuencia de un medicamento, de una cirugía, de una alteración hormonal o incluso de una enfermedad más seria. En todos los casos, merece atención, porque detrás de eso síntoma hay información valiosa sobre tu salud. El cuerpo nunca habla por hablar, y si manda esta señal, el más sabio es escucharla. Quiero que recuerdes algo fundamental: no estás alone y no has perdido tu masculinidad. Tener orgasmo sin semen no significa que tu virilidad se haya ido ni que tu vida íntima haya terminado. Lo que cambia es un mecanismo fisiológico que en la mayoría de los casos puede entenderse y tratarse. He visto a muchos hombres recuperar la confianza y la tranquilidad simplemente al recibir un diagnóstico claro. Saber qué ocurre y por qué ocurre es la mitad de la solución. Por eso insisto en la importancia de consultar con un especialista. El diagnóstico temprano abre la puerta a múltiples tratamientos y evita que un problema sencillo se convierta en algo mayor. A veces basta con ajustar un medicamento, controlar mejor una enfermedad crónica o recibir una terapia hormonal. En otros casos, se necesita un tratamiento más específico, pero siempre hay opciones. Lo más peligroso es el silencio, la resignación y la idea equivocada de que hoy no hay nada por hacer. Si este tema te resultó útil, deja tu comentario porque quiero saber tu experience y tus dudas. Comparte este video con alguien que lo necesite porque hablar de salud íntima es cuidar la vida entera. Y no olvides suscribirte para seguir aprendiendo conmigo sobre esos temas que nadie explains pero todos necesitamos entender.